स्क्रीन विजिबल हो रही है?
No, ma'am.
अब हो रही है?
Yeah. No. Yes. Now is okay, ma'am. Ma'am, only 2 minutes. Please wait, ma'am.
Okay.
Yeah, we are live. We can start. We will be live exactly. Hello.
Yeah. Thank you so much, technical tips. So, ma'am, with your permission, just I want to add some welcoming notes, ma'am. So, good evening, everyone. Good evening, doctors. Good evening, delegates. My name is Shravan Singh. I am from the Mark teams. Today, I welcome you to ECMA. So, thank you so much for taking up thesis time to be present here. Hopefully, interesting discussion. Optimizing end organ protection in management of hypertension, pivotal role of telmisartan and amlodipine. So, today I will not take any time. So, I will hand over to sessions to expert Dr. Tanjot Kaur, ma'am, MD Medicine, practicing in Dwarka. So I hand over to session expert, Dr. Tanjot Kaur. Please go ahead.
Thank you so much. Glad to be here. And today we will be discussing an important role of telmisartan and amlodipine combination. These days we not only focus on decreasing the not only focus on number, like on BP numbers, rather our main aim is to prevent end organ damage. As we all know, hypertension and a chronic hypertension has effects on multiple organs. So does this combination help us? We'll study in detail. First of all, a prevalence of hypertension. About 1/3 of India is suffering from high blood pressure. Out of them, more than half are unaware that they have high blood pressure. And those who are aware, still all of them are not on treatment and are partially under control. So these are poor stats. So hypertension is also one of the major cause for all stroke deaths and coronary heart disease. Then persistent hypertension leads to end organ damage. This is an important slide. The high blood pressure affects different organs. Like in heart, it causes left ventricle hypertrophy, myocardial infarction, heart failures, atrial fibrillation, LA-LV dilatation. In kidney, it can cause CKD, albuminuria, proteinuria, decrease in GFR. Then in eyes, again it can cause hypertensive retinopathy and microvascular remodeling. In brain, ischemic stroke, cerebral hemorrhage, microbleeds, silent microinfarcts. It can cause atherosclerosis, arterial stiffness, vascular calcification. So it affects multiple organs, and uncontrolled blood pressure will affect multiple organs. The algorithm for pharmacological blood pressure lowering. First of all, in all the hypertension patients, we must advise them having a good lifestyle. From the good lifestyle, I mean they should not be sedentary. They should have an active physical lifestyle. Tell your patients to get up from the chairs every 20 minutes. I generally tell them, and avoid extra salt in diet. Salt less, sodium chloride less than 5 gram per day is recommended, and sodium less than 2 gram per day is recommended. Generally, these days we start with dual combination therapy for the blood pressure. But in some cases, with the lower blood pressure, like in the range of 120 to 140, or in elderly patients, who sometimes start the monotherapy as well. This is to be individualized, but most of the patients require dual therapies. Then comes why combination therapy in hypertension. We know every drug has different mechanism of action. So if we will give dual therapy, there will be two mechanism of actions. that will cause a synergistic effect to reduce blood pressure. However, like I am giving patient 5 mg amlodipine, but if I will in blood pressure is still not controlled, I have two options. I can increase the dose to 10 mg amlodipine, or I can add amlodipine with telmisartan. By doing the dual therapy, I will have a synergistic effect of by two different mechanisms, but I will reduce the side effects because they both work by different mechanism of actions. So rather than increasing dose of amlodipine, which can cause pedal edema, higher dose can cause pedal edema, it is better to add drugs of two different mechanisms to reduce the side effects. Then there is a Teamster 5 study. In this study, there is a comparison between dual therapy of telmisartan and amlodipine with that of monotherapy of amlodipine. And in this study, it was found when a dual therapy was given, there's a good control on systolic blood pressure as well as in diastolic blood pressure, and the proportion of patients with BP control were also significant. So Teamster 5 study encourages dual combination. Then initial monotherapy. Initiating antihypertensive therapy with more often with combination therapy and particularly a single pill combination would improve BP control and health equity better. So it is preferred to initiate a patient with combination therapy, a single pill combinations. The initial combinations reduces the risk of cardiovascular events in hypertensive patients. We should not delay treatment with drug combinations for BP control, and hence we can reduce the cardiovascular events in hypertensive patients if we will initiate combination therapy earlier. Initial combination therapy was associated, in the study it is shown, initial combination therapy was associated with a significant reduction in the risk of cardiovascular events or death. The cardiovascular benefits of calcium channel blockers and ARBs. Amlodipine, as we all know, it is a good drug to control blood pressure. Besides being a drug to reduce blood pressure, it is also shown to reduce adverse cardiovascular events with slowing of atherosclerosis progression. So it helps in cardioprotection. The accomplished study. Here, an ACE was combined with amlodipine versus an ACE with diuretic in high-risk patients. So it was found cardiovascular events were significantly reduced by 20% in patients with ACE with amlodipine rather than with ACE with diuretic. Also, we can see in diabetic patients, combining a RAS blocker with amlodipine was superior in reducing cardiovascular events, and it could influence future management of hypertension. Also, we'll study later that it helps in reducing microalbuminuria also, kidney protection also. On the on-target trial, it was found that telmisartan was not inferior to ramipril and had conserved 95% of efficacy of ramipril. Even we can say telmisartan has almost similar efficacy to ramipril, but it has reduced side effects like cough and angioedema, which are generally seen with ramipril. So telmisartan's cardiovascular benefits, again, has telmisartan shows significant reduction in cardiovascular death, myocardial infarction, and stroke after 6 months of treatment. ACE inhibitors not only control blood pressure, but they also help in regression of left ventricular hypertrophy. They also help in reduction of atrial fibrillation recurrence. Telmisartan seems to be superior to other antihypertensive treatment to prevent atrial fibrillation recurrences in hypertensive patients with paroxysmal AF beyond BP reduction. So BP reduction is one thing. Plus, they have benefits, cardiovascular benefits. We have studied about amlodipine as well as ARBs. Then, as we have seen cardiovascular protection, now we come to renal protection. Role of these drugs in renal protection. In the innovation study, incipient nephropathic patients with type 2 diabetes mellitus and microalbuminuria receiving 80 or 40 milligram telmisartan achieved superior renal protection demonstrated by lower transition rates to overt nephropathy. So they are nephroprotective also. Telmisartan prevents progression of microalbuminuria in normotensive patients with diabetes. It is safe and well tolerated. If we compare telmisartan with other ACE inhibitors and ARBs, it has almost similar benefits and efficacy. It's well comparable. I can say it's well comparable with other ACE inhibitors and ARBs. Telmisartan amlodipine combination. 70% decrease in urine albumin to creatinine ratio was seen in those patients treated with telmisartan and amlodipine combination compared with amlodipine monotherapy. There are different trials demonstrating the role of amlodipine in and organ protection. As we have already discussed, amlodipine and telmisartan both have cardiovascular protection, and the combination helps in reducing microalbuminuria also. So they are renoprotective also. Then there is a study, a randomized controlled trial comparing telmisartan plus amlodipine and telmisartan plus cilindipine. The primary objective was to evaluate and compare the effect of telmisartan plus amlodipine versus telmisartan plus cilindipine on renal parameters and blood pressure in subjects with hypertension and renal impairment. And the secondary objective was to evaluate and compare the safety of telmisartan plus amlodipine versus telmisartan plus cilindipine. And the conclusion was both telmisartan plus amlodipine and telmisartan plus cilindipine were effective and well tolerated in the treatment of hypertension with renal impairment. Both can be used. Telmisartan and amlodipine may provide better BP reduction and similar renoprotective benefits compared to telmisartan plus cilindipine. So both of them are renoprotective. However, telmisartan and amlodipine has provided better BP reduction. So the summary is, first of all, diagnosing blood pressure in young adults is very important these days. Whichever patient comes to your OPD, just screen them for blood pressure for whatever complaint the patient comes to you. Then early and intense BP control is crucial in improving outcome in hypertensive patients. Dual combination of RAS inhibitors with telmisartan amlodipine combination, or I can say RAS and CCB should be the first line of therapy. Different trials have showed benefits of combination in cardiovascular protection and also in nephroprotection. Telmisartan plus amlodipine combination provides tighter BP control over 24 hours. This combination is cornerstone treatment of hypertension to improve patient outcomes. Hence, this combination is used not only to control blood pressure, but also to have a cardio and renal safety. Thank you so much.
Now I'd like to take this opportunity to thanks for your excellence that you provided during the meetings. This is very interesting and impactful session, ma'am. So I request to all the delegates, if you have any questions, any query, you can put on the chat box. Technical team, is there any questions in chat box? Can you paste here?
Sir,
Technical team.
request you to please refer the moderator link.
Ma'am, there is one question in chat box. How often should blood pressures be monitoring patient with hypertension? If patient should be suffering from elevated BP, should receive pharmacological treatment, it should be managed after lifestyle modifications.
Lifestyle modification is a cornerstone. But if patient comes to you with blood pressure of 170, 90, definitely lifestyle only will not work. Initially, we need to give some pharmacotherapy. But if the blood pressure is due to only faulty lifestyle, we can monitor the patient over a period of time. And then if we feel, we can step down the therapy. And in case you feel that we can stop the therapy, pharmacotherapy, but we need to have a regular BP monitoring, charting, and you need to call the patient again and again. And if you feel the blood pressure is fine over few months, so you can stop it, stop the medicine. But this is the case in the high blood pressure. But if a patient comes to you with lower borderline low blood pressure around 130 to 140, so we can go for lifestyle only.
Yeah, thank you so much, ma'am. There is one question. Dr. Sweta De from Specialty Hospital, Janakpuri. Can I prescribe if patient have BP 150 by 96, telmisartan amlodipine, considered as a effective first line combination newly diagnosed hypertension patient?
Yes. Why not? You can start with that. Newly diagnosed patient, we need to see the overall picture of the patient. If patient is not having any hyperkalemia, generally it is very safe to start with that. But if you have some blood report, there is some contraindication. The patient is having epididyledema, you will not prefer using amlodipine. You have to see if everything is okay, you can go ahead.
One is last questions, ma'am. What are the most effective treatment statement for reducing cardiovascular risk in patient with hypertension and comorbidities like diabetes and CKD?
Sorry, I didn't get your question.
What are the most effective treatment strategies for reducing cardiovascular risk in patient with hypertension and comorbidities like diabetes or CKD?
Again, we have to consult the patient first of all about the lifestyle. Every patient has to quit sedentary lifestyle. Most of the patients come to us with a sedentary lifestyle. They have to told to do physical activity, then reduce salt intake, reduce stress, have a good sleep. This is the core. We cannot miss the course. Then, if the patient is having high blood pressure, we should know our targets. Take it. It should be less than 130/80, 130/80 or less than 130/80. If patient is having diabetes, we have to treat diabetes also. Then we have to see lipid profile also, because these all are the individual risk factors for a cardiovascular disease. Everything has to be taken care of. We have to see patient as a whole. This is not BP. We have to focus on BP. We have to focus on sugars, on his weight. Overall, we have to see patient as an overall individual.
Thank you so much, ma'am. Ma'am, one more questions. During the OPD, you've seen that, ma'am. Younger generation have so many younger generation have hypertension symptoms. So any message, any suggestions from your side for younger generations, ma'am?
Just get up from your chairs. Every 20 minutes, get up from your chairs and don't panic. Get your blood pressure checked. And if you know that you have blood pressure, younger generation is generally very, they don't accept that they have high blood pressure. वो अगर आप ओपीडी में आए हैं आपने डायग्नोस किया है they will not take medicine unless until you will counsel them, you will tell them कि शुरू करनी है, you will see to that. तो पहली बात, whenever you visit to a doctor for whatever reason, get your blood pressure checked. And secondly, if you are diagnosed with a high blood pressure, if a doctor diagnoses you with a high blood pressure and doctor advises you medicines, you must follow your doctor's advice.
Thanks, ma'am. Thank you so much. There are no more questions in chat box. So thank you so much for very interesting session. It will be definitely help to all delegates for managing the hypertension, newly diagnosed and uncontrolled hypertensions. So just for requesting for ma'am for tell my AMs to all delegates, and thank you so much, ma'am, for taking your giving your valuable times, ma'am, and taking your
Okay.
very interesting session.
Okay.
Have a great day, ma'am, and thank you so much all delegates, ma'am. 26 delegates are attending this session, ma'am. I'm very thankful to all delegates for attending this session. Have a
Thank
great
you.
day.
Have a nice day.
Sir, with your permission, can I
Thank you.
conclude?